Hello, everyone. My name is Cassie Bush, and I am the Chief of the Policy and Training Section in the Provider Enrollment Division, PED, at the Department of Healthcare Services. I am also joined by Jim Elliott, Chief of the Medi-Cal Benefits Policy Branch in the Benefits Division, and Misty Chittick, Chief of the Application Processing Branch in PED, and Alex Hernandez, Analyst in the Policy Unit at PED. Today, we will be discussing the Regulatory Provider Bulletin titled Updated Medi-Cal Enrollment Requirements and Procedures for Community-Based Organizations, Local Health Jurisdictions, and County Children and Families Commissions. The purpose of today's hearing is to go over the draft Provider Bulletin and provide you with an opportunity for discussion of the Provider Bulletin. For our agenda today, we will provide a bulletin overview, and then we will go over the updated Medi-Cal enrollment requirements and procedures. Lastly, we will end with comments and questions. Before we begin, I have a few quick reminders. If you are experiencing any technical issues, please send us an email to dhcsped@dhcs.ca.gov for help. Please hold all comments and questions until the end of the presentation. We will have plenty of time for comments and questions at the end. Please be sure to send any questions or comments made in the chat box to everyone. Comments not shared during this hearing can be sent to DHCS stakeholder at dhcs.ca.gov. Only written comments received by email by 5 p.m. today will be considered prior to publication of the final bulletin. This hearing will be recorded and posted on our stakeholder hearing information webpage for future reference at a later date. We will provide a link to that webpage in the chat box now. Today we will be going over the draft provider bulletin titled Updated Medi-Cal Enrollment Requirements and Procedures for Community-Based Organizations, Local Health Jurisdictions, and County Children and Families Commissions. As a reminder, a copy of the draft provider bulletin was attached in the stakeholder hearing invitation email that was sent on September 23, 2024. We will also provide a link to the draft provider bulletin for reference in the chat box now. In accordance with Welfare and Institutions Code W&I, Section 14043.75b, the Department of Healthcare Services DHCS Director is establishing the specific application and enrollment requirements for community-based organizations, CBOs, local health jurisdictions, LHJs, and county children and families commissions that apply for enrollment in the Medi-Cal program to be reimbursed for the covered services they provide to Medi-Cal members. These requirements implement and make specific W&I Code sections 14043.15 and 14043.26, and as such, have the full force and effect of law. Also, this bulletin does not substitute for or eliminate all other enrollment requirements set forth in W&I Code section 14043.26. Effective November 25th, 2024, CBO applications may include community health workers, CHWs, offering justice involved JI services, and licensed or unlicensed individuals rendering care management services. This option will be available to both first-time CBO applicants and currently enrolled CBO providers submitting a supplemental application. Additionally, county children and families commissions will be eligible to apply to enroll in the Medi-Cal program for CHW and asthma preventative AP services. And now we will go to Alex, who will review the draft provider bulletin in more detail, starting with CBOs providing JI services.
Thank you, Cassie. This provider bulletin will allow CBO applicants and currently enrolled CBO providers submitting a supplemental application to add JI services to their enrollment. CBO applicants and providers must attest that all of their CHWs meet the qualifications listed in the state plan for CHWs for whom they will bill either DHCS or a managed care plan contracted with DHCS for the delivery of JI services provided to members enrolled in Medi-Cal. The CBO applicant must attest they understand that DHCS may audit the CBO to verify CHW qualifications and services provided, and that the CBO must supply documentation upon DHCS's request. This attestation does not supersede any of DHCS's authority to audit or request records from the provider pursuant to state and federal law and the provider agreement. CBO applicants must report the name of each individual providing JI services in the application. The attestation is built into the electronic application through the provider application and validation for enrollment. This provider bulletin will also allow CBO applicants to report JI services offered by providers other than CHWs. CBO applicants must report all licensed individuals who will render care management services and attest that any unlicensed individual rendering care management services will work under the supervision of a licensed behavioral health provider as allowed by state law. CBO applicants must report all of their following information of the licensed or unlicensed individual for whom they will bill either DHCS or a MCP contracted with DHCS for the delivery of GI services provided to members enrolled in Medi-Cal. The required information includes National Provider Identifier or NPI, professional license number, and Social Security number or individual tax identification number. Additionally, the CBO applicant must attest that they understand that DHCS may audit the CBO to verify provider qualifications and services provided, and that the CBO must supply documentation upon DHCS's request. This attestation does not supersede any of DHCS's authority to audit or request records from the provider pursuant to state and federal law and the provider agreement. CBO applicants must report the name of each individual providing JI services in the application. This attestation is built into the electronic application through PAVE. Now we'll review the Medi-Cal enrollment requirements and procedures for county children and family commissions. County children and family commissions that provide CHW and AP services will be eligible to apply for enrollment in the Medi-Cal program. A county children and families commission must be established pursuant to Health and Safety Code section 130-100 and the sections that follow. County Children and Families Commission applicants must meet current Medi-Cal provider enrollment requirements and standards, as well as requirements set forth in this bulletin. Furthermore, Medi-Cal enrollment standards require applicants abide by all state and local laws and ordinances pursuant to California Code of Regulations, Title 22, Section 51,000.30E and 51,000.60 C4. These requirements and standards include, but are not limited to, obtaining the applicable business license when required by local laws and ordinances, and having a Type 2 MPI. County Children and Families Commission applicants must have at least one administrative location in California, which must be reported on their application. For this provider bulletin, an administrative location is defined as the physical location associated with the applicant's operations, which can include where services are dispatched or based. DHCS DHCS recognizes that the actual services may occur at administrative locations, but may also occur solely in community settings which do not have to be separately enrolled. For this provider bulletin, a community setting is defined as a location where persons employed by or contracted with a provider furnish services outside of their administrative locations. The administrative location reported on the application must not be a private residence, virtual office, or mailbox, and may not be reported using a post office box. For the reported administrative location, applicants must provide a signed lease agreement, maintain valid workers' compensation insurance, and comprehensive general liability insurance that cover the reported administrative location and operations. And finally, have reported posted signage identifying the name of the provider and the business hours. The administrative address reported on the application will appear in provider directories and in the California Health and Human Services Open Data Portal. Applicants must apply to enroll in the Medi-Cal program by submitting an electronic application through the PAVE online enrollment portal, along with all supporting documentation. When applying through PAVE, County Children and Family Commission providers may select LHJ from the drop-down menu. County Children and Family Commissions must complete the CHW and/or AP services attestations that are built into the electronic application through PAVE. Now I'll pass it back to Cassie for the comments and questions portion of the hearing.
Thank you for listening to our presentation. If you would like to share a comment or ask a question, you may either raise your virtual hand or type it in the chat box. Please send any comments or questions made in the chat box to everyone. If there are any questions that are not answered during this hearing, please note that we will address those questions along with all other questions submitted to us in the chat box or by email in a questions and answers document that will be posted to our website at a later date. Now we will go through the questions in the chat box. I currently do not see any questions in the chat box. Now we will go to WA for any raised virtual hands. Please note if you have your virtual hand raised, we will unmute you individually so you can ask your question verbally.
All right, Cassie, we do have one question from Alexandria, and I'm gonna unmute. Go ahead.
And the First Five Association of California. Thanks for this conversation today. I just had one question. It's my understanding that for California Children and Family Commissions who are already enrolled as providers with their managed care plans, once this PAVE pathway is open, they'll have to enroll through PAVE as well, in addition to the work they've done to be kind of vetted by their managed care plans. So we understand that. And I'm curious about, once this is open, just being clear about the timeline for the California Children and Families Commissions to be able to get this work done. We don't want to interrupt any care that those entities are currently providing to children in their counties. Thank you.
Thank you, Alexandria. The bulletin will be effective November 25th, 2024, so you are able to apply after that time. And if you have any additional questions, please feel free to submit your inquiry via email, and we will respond in a timely manner if you need additional specifics.
And Cassie, we do have another question from Courtney. One more raised hand, so I'm going to go ahead and unmute at this time, and then we'll go ahead and move back to the chat box.
Thank you. Go ahead, Courtney.
Courtney Armstrong with the First Five Association as well. So just to follow up on Alexandra's question, after the bulletin is effective on November 25th, I think what she was asking is, will So we have CCFCs that are currently Medi-Cal providers. Will that be paused at all while they go through this paved pathway, or will they be able to continue to provide services while they go through this paved pathway? Because we don't want to interrupt sort of ongoing services once this pathway is open, I guess would be our editorial comment.
Thank you, Courtney. We are still researching that. If you both could submit your questions via email specific to your question and to that provider type, I would appreciate it. We will answer that in a timely fashion and provide you with additional specifics.
Okay, thank you.
Thank you. All right, so we will go back to the chat box. From Mary Daniels, when will the slides be shared? Those will be shared at a later date in the near future. And once those are shared, we will also email stakeholders to additionally share that information. Let's see here. The comments that are in the chat box right now will require further research as they're specific to certain provider types, including AEVSs. And as far as managed care plans, from Cheryl Winter, Jim, if you want to take on that question, Cheryl Winter is asking, is there work underway to allow CBOs offering community supports to enroll as providers? We are excited to see that CHWs working in JI can enroll to CBOs, and we could see a great need for other MCPs, contracted CBOs to enroll and have access to EVS and PAVE as well. Jim, if you want to go ahead and add additional information regarding MCPs or benefits related to that question, if it's helpful, feel free to do so now. I think Jim might be having technical difficulties. Jim, are you able to hear us? All right. Looks like Jim is having technical difficulties. We apologize. The additional questions, like I said, we will take those questions. If you could provide those questions in email as they are specific to certain provider types, we will get additional clarification via email, and we will ensure to submit a response in a timely manner. Any other virtual hands?
I see Courtney's hand still raised. I'm not sure. Do you have another question, Courtney? Oh, okay, never mind. That has that's gone down. So no raised virtual hands at this time.
All right. We can go ahead and move on to slide 19, Wab. Great. As mentioned earlier, if there are any additional questions that are not answered during this hearing, please note that we will discuss those questions along with all other questions submitted to us in the chat box or by email in a question and answers document that will be posted to our website at a later date. As a reminder, any comments or questions not shared during the hearing can be sent via email. All comments, feedback, and/or questions must be sent to DHCS PED stakeholder at dhcs.ca.gov and received by 5 p.m. today for consideration of the final version. Please make sure you reference your name, organization, if you're affiliated with one, and the provider bulletin title in your email. We will be leaving the chat box open for the next few minutes to allow time for anyone who wants to copy any of the links provided during our hearing today or add any last-minute comments or questions. Thank you again for your attendance and for your participation. This hearing is now adjourned.